The bottom line for people is that if you're on Medicare Advantage plan, if you have a Part D plan, those are annual contracts. 2025 going to be a volatile year.
We do not offer every plan available in your area. Currently, we represent approximately 15 organizations which offer over 100 products nationwide. Please contact Medicare.gov, 1-800-MEDICARE, or your local state health insurance program, SHIP, to get information on all of your options.
Welcome to Maximize Your Medicare. My name is J.O. I'm the author of Maximize Your Medicare, the 2024-2025 edition, available anywhere you can buy a book. In the newsletter called Jay's Corner, I've made a number of statements to tell you that the only possible conclusion, reasonable, common sense conclusion, is that 2025 is going to be kind of a mess. There's a number of reasons to that. In this video, I'll review why and give you the latest updates. Followers here know that I've been making this point specifically, and this is from Barron's. You can see it here. This is from Barron's magazine. Medicare Advantage is under fire, what it means for your health and your wallet. And then it says, insurers may cut back on benefits as profits get squeezed, why Medigap Medicare could be better for consumers. We'll talk about that. Meaning that what you have here is we've got an allowance system that the CMS gives to every Medicare Advantage policy owner. So basically, you enroll, become a Medicare Advantage plan member. That plan receives X dollars, just like an allowance. Okay, now that allowance gets adjusted based on your specific health score, based on your history and information that you may or may not provide to the carrier. So what happens here is now you can see the fire, which is Medicare Advantage plan to see base pay fall. So in other words, this is the cut in the allowance. And therefore you can see why I have called 2025 an almost certain mess. Well, in that, now you're going to see, for example, this new headline, which just came out this past Thursday, which is Medicare Advantage insurers will collect extra bonuses. So basically what has happened is due to this, that the Medicare Advantage plans will be paid less, if you will, and that was creating such a problem that in fact that the CMS basically blinked. And what ended up happening is that you'll see that could get hundreds of millions of dollars in bonuses this year after the federal officials said they would recalculate the program's quality ratings. So part of this allowance has to do with the STAR system. Well, now what we have here is this complicated soup, and this is why I've called it a mess, because what usually ends up happening is the proposals for 2025 were already due. And now what you end up having is that had to submit by June 3rd, but now regulators will accept submissions until June 28th. What I found very surprising is by now, I should have received lots of previews. What's coming up in 2025? My inbox gets filled with previews from carriers because we represent a lot of the carriers. In fact, we represent all of the nationally prominent carriers for sure, as well as including certain very, very large state centralized, state dominated Medicare plans. And today is not an offer of insurance of any sort, but I'm just giving you some updates on the news. Now, the fact is you can see here, and I actually read it by error, why a Medicare Medigap plan could be a better deal for consumers. Yeah, I think that this is what happens in the media, that there's many times I've reviewed it here on the Maximize Your Medicare channel, also in my book. Medigap is a standardized grandfathered plan. In other words, only the premium can change, not the benefits. That's over here. Over here is Medicare Advantage, where it's annual contract. This is the basic difference. From there, the details change, right? Which is, I've already stated that over here, Medigap, standardized, grandfathered, only the premium can change. Over here, Medicare Advantage, every detail, every single detail can change because the Medicare Advantage plan carrier is the final arbiter. It is the judge and jury. Now, there's an appeal process, for example, if your claim is denied, but let's leave that to the side for a different topic. Basically, what ends up happening as a result is this is why the crossfire. Now, the fact is that I don't love any time that why a Medicare or Medigap plan could be a better deal for consumers. This is actually the even-handed version of it. And there are other videos here on the channel. I've made light of this in other places. That when the media says it's a trap, I just absolutely, completely reject it. They are different. That doesn't make one a trap. Again, the analogy is you thought the rook moved the same as the knight. Doesn't. It's just simple. And the tough love version is, look, you didn't bother to understand how this worked. So as a result, after the fact, then you were surprised. That's what the point of the channel and my book is about, in order to clearly understand the differences so that you can make the choice based on your own private situation. The reason I try to be this even-handed is just very, very clear, because this is KFF, which, as many people on this channel would know, that is the top end of resources regarding just information about Medicare specifically. Very, very good. One of two, I've stated. But you can see it here. In 2023, half of all people with Medicare had incomes below $36,000. There it is right there. We can say that Medigap is the superior construct, meaning that because of that fact that the language is grandfathered, because it's standardized, meaning Jay's insurance company and United Healthcare's Medigap Plan N are identical down to the comma, which is true, it comes at a cost, meaning this is easily, at the very minimum, can be considered to be something in the area of $1,200 for a 65-year-old female who's turning 65. That is certainly, and that is the bottom, that's for Plan G. That's pretty much the lowest price you'll be able to find for the most part, and in different states, notably higher. Hello to New York and to Florida. But what you can what you can see here from this graphic, $1,000 a year, and then if you had a married couple, $2,000 a year out of $36,000 is a lot, right? That represents what? 2 out of 36 is 1 out of 18, more than 5% of your annual income just to go for premium, of which, for example, if you're Mr. and Mrs. Perfect, you have 25 children who need extra financial support, and you live on Social Security alone, of which you can see this is a lot of the population, a lot. So my point is that just to try to encourage people to be very even-handed. This mess is going to exist. This is true. These are true. These are all true. And is it complicated? Yes. Why? Because the fundamentals are that Medicare Advantage is still annual contract. The bottom line for people is that if you're on Medicare Advantage plan, if you have a Part D plan, those are annual contracts. 2025 going to be a volatile year. I don't think that it's unreasonable for me to predict that. It is not a heroic prediction. People, followers to both this as well as the newsletter, which is Jay's Corner, you can see the link in the picture below my video by video image, jo.substack.com, is the fact that you want to stay updated because of the fact that these changes are coming for sure, almost for sure. And as a result, what is best for you can change. For 2025, that's even more so. I'm convinced. That's it for today. Trying to keep it short. Be sure to subscribe to this channel. There's another channel called Jay's Corner, which has a lot more financial information, financial basics, as well as complex. Hopefully you've liked today's video. See you next time.